Have you ever looked at a loved one, perhaps your spouse, your sibling, or a dear friend, and felt something subtle had changed? Not something dramatic or sudden, but a quiet shift in their energy, appetite, or spirit? As a physician with over 3 decades studying the aging process and end-of-life transitions, I've learned one powerful truth. The human body rarely stops without first whispering its intention. Yet most of us miss those whispers. Not because we don't care, but because the signs are often mistaken for just getting old. We dismiss the extra sleep, the skipped meals, the distant stare as harmless aging quirks. But in reality, they may be early indicators that the body is preparing for its final chapter. In this video, we're going to explore 5 subtle but critical signs that may suggest a person is entering the final year of life. I'm not sharing this to alarm you, but to empower you. Because when families recognize these clues early, they don't just react, they prepare. They focus on presence over prescriptions, peace over panic. We'll separate the myths from the medical truths and explain why these signals happen, what they mean biologically, and how you can respond with clarity, care, and calm. If you've noticed small changes and felt unsure of what they mean, stay with me. What you'll learn in the next few minutes may change the way you approach aging, not with fear, but with compassion and confidence. Because knowing what's coming is the first step to facing it with grace. 1. Significant weight loss without clear cause. One of the earliest and most commonly overlooked indicators that someone may be entering the final stage of life is unexplained, sustained weight loss. It's easy to miss. Perhaps your pants fit a little looser, or you've stopped craving that hearty breakfast you used to love. Family members might even compliment the weight loss at first. But from a medical perspective, weight loss in seniors isn't always a sign of improvement. It can be a red flag. In my years of clinical observation, I've found that when an older adult starts shedding pounds without trying, especially over a few weeks or months, it's rarely incidental. More often, it signals a deeper metabolic shift, where the body is no longer processing nutrients efficiently. This can result from a combination of muscle atrophy, reduced appetite, hormonal changes, and sometimes a slowdown in digestive function altogether. Let's break it down. As we age, muscle mass naturally declines, a condition called sarcopenia. But when this process accelerates, it may suggest that the body's entering a catabolic state, where it's using its own tissues for energy due to inadequate intake or impaired absorption. This isn't just about losing a little strength. It weakens the immune system, increases the risk of falls, slows wound healing, and affects vital organ performance. Now you might be wondering, couldn't this just be normal aging? The answer is, sometimes yes, but not when the weight loss is rapid, persistent, and accompanied by fatigue, weakness, or changes in appetite. In clinical terms, we often see unintentional weight loss associated with chronic illnesses like cancer, congestive heart failure, COPD, or kidney disease. But it can also stem from cognitive decline, undiagnosed depression, or even subtle infections that suppress the appetite. The tricky part is, many of these conditions manifest quietly in older adults. They don't always come with dramatic symptoms, just slow, steady weight loss and an increasing disinterest in food. And let's talk about appetite. As the body nears the end of life, the brain's hunger signals become disrupted. Food may no longer taste the same. Smells that once brought comfort may seem off-putting. The digestive system slows down, making large meals uncomfortable. Forcing more food isn't the answer. In fact, it can cause distress. So what should you do if you or someone you love is experiencing this? First, don't panic, but do pay attention. Track any weight changes. Notice patterns. How much is being eaten, energy levels, and physical strength. If the weight continues to decline, even with nutritional support like smoothies or protein shakes, it may be time to shift the focus from correction to comfort. In end-of-life care, the priority becomes quality over quantity, not just in food, but in time, energy, and experience. Unexplained weight loss is the body's way of speaking. As a doctor, I encourage families not to see it as defeat, but as an opportunity to listen, to support, and to create comfort in the time that remains. 2. Extreme fatigue and prolonged weakness. As someone who has spent decades studying human physiology and the aging process, I can tell you that fatigue is never just about feeling tired, especially in older adults. When fatigue becomes persistent, intense, and interferes with even basic tasks, it may be the body signaling that it's entering a final, slower phase of life. We're not talking about being a little tired after gardening or missing a good night's sleep. We're talking about a kind of deep, unshakable exhaustion that doesn't improve with rest. I've had patients describe it as bone-deep tiredness, the type that makes brushing their teeth feel like a marathon. Physiologically, this level of fatigue often stems from declining organ function. The heart may not pump as efficiently, meaning less oxygen gets to the muscles. The lungs may no longer fully exchange air, and the kidneys or liver may start filtering waste at a slower pace. Together, these subtle changes reduce the body's ability to generate energy. It's like trying to drive a car with a failing engine. You can press the gas, but the power just isn't there. Additionally, the body begins to redirect energy away from activities that are non-essential to survival. Cognitive processes, digestion, and even muscle strength may decline, not because the person is giving up, but because the body is conserving what little energy it has left. One of the more heartbreaking aspects I've observed in families is the emotional toll this fatigue takes. Many seniors feel frustrated or embarrassed that they can no longer participate in family outings, cook dinner, or even walk to the mailbox. Their self-worth, often tied to independence, can suffer. And unfortunately, well-meaning family members sometimes misinterpret this fatigue as laziness, depression, or a lack of will. But the truth is this: no amount of pushing will restore energy that simply isn't there. It's important to recognize that this form of exhaustion is a biological message, not a personal failure. Encouraging activity can be counterproductive and even harmful. Instead, we should shift our focus to supporting their pace. That might mean helping them find comfortable positions to rest in, planning conversations during times of day when they have more alertness, or simplifying their routines. You may also notice increased daytime sleepiness, longer naps, or frequent rest breaks throughout the day. These aren't signs of disengagement. They're survival strategies. When the body senses its time is limited, it focuses on stillness, not stamina. So if someone you love is experiencing this kind of fatigue, I encourage you to stop measuring their days in steps or chores and start measuring them in presence, comfort, and connection. Let them lead. Listen to their pace, and remember, offering grace and patience is often the most powerful form of care. 3. Cognitive confusion and social withdrawal. One of the most subtle and often most painful shifts I've observed in older patients nearing the final phase of life is a change in mental clarity and social engagement. Families often describe it like this: Dad just isn't himself lately. Mom keeps asking the same question over and over. Or perhaps she doesn't want to talk anymore. She just stares out the window. These aren't isolated quirks. They're signs of something deeper, the brain gradually beginning to disconnect. Cognitive confusion can begin in small, almost imperceptible ways. A forgotten name, trouble following a conversation, getting lost in familiar places. For someone who's been mentally sharp all their life, these changes can be distressing, and they often come before any formal diagnosis like dementia or Alzheimer's. What's happening biologically? In simple terms, as blood flow and oxygen delivery to the brain decrease, brain cells begin to struggle. Neurons, which depend on constant nourishment to fire and communicate, slow down. The result isn't always dramatic. It can look like hesitation in speech, a loss of interest in complex activities, or trouble making decisions that used to be second nature. But there's another layer here that families often overlook: emotional withdrawal. Many elders nearing the end of life retreat into themselves. They may avoid phone calls, stop participating in conversations, or seem disengaged from birthdays, holidays, or even meals. This isn't because they no longer care. In fact, their emotional core often remains deeply intact. But the cognitive effort required to interact, to track words, respond appropriately, and stay alert, becomes too taxing. I've seen patients who once hosted Sunday dinners now quietly sit in the corner while family gathers. I've watched once lively storytellers fall silent, and perhaps most painfully, I've heard adult children say, "It's like I've already lost them, even though they're still here." But this too is part of the body's preparation for transition. The brain begins to conserve energy just as the rest of the body does. Lucidity may flicker in and out, like a light bulb dimming before it goes dark, and that can be deeply disorienting for both the person and their loved ones. So, what can you do? First, respond with patience, not panic. Reorient gently when confusion arises. Use calm tones. Avoid overwhelming environments. Even if their words fade, your presence still speaks volumes. Sometimes a hand held in silence offers more comfort than a dozen conversations. Second, understand that social withdrawal is not rejection, it's self-protection. Honor their need for quiet without taking it personally. And lastly, this is the time to create moments that don't demand effort, just presence. A soft song playing nearby, familiar scents, quiet companionship. Because even when memory fades, the feeling of being loved remains. 4. Frequent infections and slow healing. In my years working with aging patients, one of the clearest yet least discussed signs of late life decline is this. The immune system simply doesn't bounce back the way it used to. If you or someone you love has started to experience frequent infections, like recurring urinary tract infections, bouts of bronchitis, or persistent skin issues, it could be more than just bad luck or seasonal bugs. It might be the body's way of saying, "I'm winding down." You see, our immune system is like an army, constantly defending us against outside threats. But as we age, particularly in the final year of life, this army grows smaller and slower. The production of white blood cells decreases, inflammation becomes more common, and even the body's response to basic injuries, like a small cut or bruise, can become sluggish. In practice, I've seen patients develop minor scrapes that linger for weeks, or a cough that once resolved in days now stretching into months. Sometimes infections don't show up with the usual signs. An elderly patient might not spike a fever, but instead become suddenly confused, withdrawn, or stop eating. These are often the body's quieter distress signals, and they're easily overlooked. What many don't realize is that poor circulation also plays a major role. As the heart weakens and blood flow slows, oxygen and nutrients no longer reach tissues efficiently. This not only delays healing, but also makes it harder for antibiotics or other treatments to reach the areas they're needed. That's why small wounds, especially pressure sores in those who are bedbound, can quickly turn into serious infections if not closely monitored. And yes, while it's tempting to think that another round of antibiotics might fix the problem, repeated use of medication doesn't always lead to recovery. In fact, over time, the body becomes less responsive. Instead of focusing on aggressive cures, I often advise families to shift their goal, prioritize comfort, not combat. That might mean keeping skin clean and moisturized, making sure clothing isn't too tight, adjusting bedding to avoid pressure points, or helping the person move gently a few times a day. These small acts of care can do more for quality of life than another hospital visit. It's also important to know that many infections in late life aren't preventable, even with the best care. They're part of the natural progression as the immune defense is lower and the body prioritizes core survival functions. So if you've noticed more frequent infections, slower healing, or subtle signs like confusion or fatigue after an illness, take it seriously, but also tenderly. These are signs to lean in, not push harder. Because at this stage, healing isn't always about getting better. It's about being there, being gentle, and making sure your loved one knows they're not facing this alone. 5. Major changes in breathing and circulation. If you've ever sat beside an aging loved one and noticed their breathing shift, becoming shallow, irregular, or oddly quiet, you may have felt a pang of worry you couldn't quite explain. From my years working with older adults in end-of-life care, I can tell you, when the body nears its final stage, the rhythm of breath and the flow of blood start to tell their own story. These changes don't happen overnight. They arrive gradually, First a shortness of breath while climbing stairs, then needing to catch one's breath just sitting upright, and finally those long pauses between breaths that can make your heart skip. What's going on here? In simple terms, as the heart weakens and circulation slows, the lungs receive less blood and oxygen exchange becomes less efficient. The body in its wisdom begins conserving energy. Less effort is spent on deep, full breaths. Breathing becomes shallow, sometimes punctuated by pauses, gasping, or a rhythmic pattern known as Cheney-Stokes respiration, where breathing alternates between rapid breaths and long silences. For many families, this can be one of the most unsettling changes to witness. I've had spouses call in tears, worried their partner is suffocating or struggling to stay alive. But in most cases, the person isn't in distress. They're simply in transition. The sensation of air hunger that alarms loved ones may not be as intense for the person experiencing it, especially if they're sedated or naturally less aware. Another clear sign of circulatory change is the temperature and color of the skin, particularly in the hands, feet, ears, and nose. As the heart works harder to maintain blood flow to vital organs, it redirects blood away from the extremities. This can cause limbs to feel cool or cold, and the skin may appear pale, bluish, or mottled. These shifts aren't reversible with warm blankets or deep breaths. They're part of the body's natural slowing, a final act of conservation. You may also see swelling in the lower legs due to fluid retention, or hear a soft gurgling in the chest caused by secretions that the body no longer has the strength to clear. Now, it's important to emphasize, while these signs may look alarming, they don't always cause suffering. In fact, with proper care, like elevating the head, keeping the air moist with a humidifier, or using low-dose oxygen therapy, many of these symptoms can be managed gently and respectfully. This is the point where treatment shifts from intervention to comfort and dignity. Our role isn't to reverse the process, but to walk beside our loved ones with calm presence. So if you notice these changes, labored breathing, cold extremities, mottled skin, don't panic. Instead, pause. Hold their hand. Speak softly. Let them know they're not alone. Because in these final moments, what matters most isn't how they breathe, but how they feel. As we bring this discussion to a close, I invite you to take a quiet moment and reflect, not just on what we've covered, but on the deeper message behind it. The signs we've talked about, unexplained weight loss, persistent fatigue, cognitive confusion, recurrent infections, and changes in breathing or circulation, aren't merely clinical observations. They are the body's way of whispering that it's preparing for a transition. As a physician who has accompanied countless individuals and families through these final stages, I can tell you that understanding these signs is not about giving up hope. It's about shifting our definition of care. Instead of focusing solely on treatment, we begin to focus on presence, on listening, on providing comfort, dignity, and the reassurance that no one has to face this alone. Death is not a failure of medicine. It is a natural conclusion of life. When we recognize the early signs and prepare emotionally, we give ourselves and our loved ones the gift of peace. We create space for meaningful conversations, quiet moments, and small joys that otherwise might be lost in the rush to fix what cannot be fixed. So if you see these changes in someone you love, I urge you not to panic, but to lean in with compassion. Sit with them. Ask what they need. Say the things that matter. Because in the end, the most powerful medicine we can offer may not be found in a bottle, but in the way we show up with love. Thank you for spending this time with me. I hope it brings you clarity, courage, and comfort on your journey.